Okay.
And then let him know, and if I need to do something, let me know.
Okay. Okay. Great. Thank you.
All right.
Thank you.
Okay.
But I did copy you, so
And he knows me too.
Do I have a new one? Well, here's my old one. Does that work? It still works? Okay, I'll wear this one.
Good luck with that.
We'd like to call this evening's meeting of the Peoria City Council to order. Welcome Kathy Reinerson and her listening audience at WCBU as well as Cable Channel 22. Madam Clerk, the council microphones are open for roll call.
Mayor Artis.
Here.
Councilmember Ali. Here. Councilmember Sear. Here. Councilmember Grayeb.
here.
Councilmember Jensen. Councilmember Kelly. Here. Councilmember Montalongo.
Here.
Councilmember Moore. Councilmember Euler.
Here.
Councilmember Riggenbach. And Councilmember Ruckriegel.
Here.
You have a quorum present, Mr. Chairman.
Thank you, Madam Clerk. We'd like to invite everyone to join us and stand for a moment of silent prayer or silent reflection followed by the Pledge of Allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have a couple present proclamations this evening. We'll start with 2020 Meals on Wheels. Whereas on March 22, 1972, President Richard Nixon signed into law a measure that amended the Older Americans Act of 1965 and established a national nutrition program for seniors 60 years and older. And whereas in March of 2002, Meals on Wheels America established the March for Meals campaign to raise awareness about the escalating problem of senior hunger in America while recognizing the importance of the Older Americans Act nutrition programs. And whereas the 2020 observance of March for Meals celebrates 18 years of providing an opportunity to support Meals on Wheels programs by donating, volunteering, and raising awareness about senior hunger and isolation. And whereas volunteers for Meals on Wheels programs are the backbone of the program, they not only deliver nutritious meals to seniors and individuals with disabilities who are at significant risk of hunger and isolation, but also provide caring concern and attention to their welfare. And whereas Meals on Wheels programs provide a powerful socialization opportunity for millions of seniors to help combat the negative health effects and economic consequences of loneliness and isolation, now therefore I, Jim Artis, Mayor of the City of Peoria, do hereby proclaim March of 2020 as the 18th Annual March for Meals Month in Peoria, Illinois. We have Brent Ost with us tonight, who's the Development Director of the Neighborhood House, to give us a little more information. Brent, welcome.
Thank you, Mayor. We appreciate the proclamation and the consideration of the proclamation. Senior hunger is a need that keeps growing year after year. We currently serve 750 meals a day in Peoria and Tazewell counties. It's a need that keeps growing. And getting the awareness out and getting the name out and making people realize the need for senior hunger is important. So we appreciate the time and I appreciate the recognition. Thank you.
Next, we have the 75th anniversary of the public release of penicillin. Whereas Penicillium rubens was discovered in 1928 by Dr. Alexander Fleming at St. Mary's Medical School in London. Dr. Fleming identified the mold as a penicillin and called the restrictive substance penicillin. He found it useful in preventing bacterial contamination of influenza culture, which was a disease raging at the time. And whereas about 10 years later, Howard Florey, Norman Heatley, and Ernest Chain at the Sir William Dunn School of Pathology, Oxford University, noticed the penicillin work by Dr. Fleming. They began efforts to increase the viability and yield of penicillin, but because of the war, they were pressed to find equipment, personnel, and materials to effectively produce the needed penicillin to treat the injuries occurring. And whereas the Oxford team decided to seek help at the Department of Agriculture lab, formerly known as NRRL and now NCAUR in Peoria, because of the fermentation expertise located there. And whereas in 1941, the initial work at the USDA Ag Lab in Peoria consisted of finding another penicillium strain that would be more productive than Dr. Fleming's original mold and survive a more rigorous deep tank submerged culture production method. Samples poured in from everywhere. Eventually, a cantaloupe found at a downtown market in Peoria yielded the penicillium mold. A technician at the Ag Lab referred to as Moldy Mary was credited as the discoverer of the strain. That strain was widely distributed for further research because of its higher yield of penicillin and its ability to grow in the submerged culture tanks. And whereas the University of Wisconsin and the Carnegie Institute at Cold Harbor modified this strain to make it even more productive. Pfizer, Merck, Squibb, Letterly, and others adjusted their methods, which resulted in higher yields of penicillin. The magnitude of cooperation in research between so many entities on a project was unheard of. And whereas penicillin is still the most important antibiotic in the world, and the cantaloupe derived strain of Penicillium rubens is still used to produce penicillin commercially today. The methods developed in Peoria pioneered the production of all other antibiotics after it, and 75 years ago, on March 15, 1945, penicillin was released for civilian use in the United States. Now, therefore, I, Jim Ardis, Mayor of the City of Peoria, Illinois, do hereby urge all of us to remember the commitments of so many who brought incurable suffering from infectious diseases around the world to an end, and celebrate the 75th anniversary of the public release of penicillin in Peoria, Illinois. It's kind of appropriate that we would be having this discussion or this acknowledgement through the proclamation at a time that the world is facing a lot of the issues that we are. Tonight we have Gary Kuznar, who's the co-chair of the Illinois State Microbe Designation Project, and Dr. Neil Price, who is the other co-chair of the Illinois State Microbe Designation Project, with us. We're glad to have them here this evening. It probably goes without saying, although it did in the proclamation, that so many of us drive past, I still call it the Ag Lab, NCAUR, every day, and don't really comprehend the unbelievable amount of research that's done in there year in, year out. Last I recall, there was close to 200 PhDs working every day, not to mention some of the other contractors and other folks. So it's an outstanding resource. Peoria is very fortunate to have it in our community, and we appreciate you both coming in today to let us acknowledge you for 75 years of penicillin.
Thank you, Mayor Ardis, council, and guests. Thank you for recognizing March 15, 2020 as the 75th anniversary of the date of penicillin released for public use. The current situation reminds us of the importance that medicine has in our lives. Early research was done in England, but it's not chance that the work to be done on mass production came to Peoria, Illinois. United States industry was not affected by World War II, and fermentation research was well established in Peoria. For those reasons, the project was directed here. After the accidental discovery of antibiotic properties of penicillin in England, other accidental discoveries important for penicillin's success were made here in Peoria. The first was that the penicillium mold found on the cantaloupe in the downtown Peoria market yield many times that of the original mold brought here from England. Another discovery involved corn steep liquor, a byproduct of starch production, a kind of molasses. Corn steep liquor was found to be the ideal media for growing that Peoria penicillium. Later analysis reported that it contained a precursor molecule to penicillin. Eventually, submerged culture methods for the mass production of penicillin were established, and penicillin became more available. As a result of our project for naming the penicillin discovered in Peoria as a state microbe, we're coming out with some t-shirts for fundraising, and this is one of the t-shirts here. It has an illustration from one of the books that was done in the 40s on penicillin, and the illustration was done by a woman scientist that was a teacher in Lewiston before she came to the lab. The other t-shirt that we've came up with was one that was inevitable, and that is penicillin plays in Peoria. Okay. Should show you this too.
Mayor Artis and ladies and gentlemen, my name is Neil Price. I'm a researcher at the USDA NCAR lab in Peoria, where I work on the development of new antibiotics. So this evening I brought some props with me to show you. This is the actual penicillium strain, Penicillium rubens NRRL 1951. It's embedded in plastic, so we're perfectly safe here. And it was isolated from a cantaloupe melon in Peoria Market by Mary Hunt back in 1941. So Mary Hunt became the legendary Moldy Mary. And so we have a painting of Moldy Mary back from in 1941. And this painting is actually now currently in the Riverfront Museum in Peoria. And it's on loan there from the University of Wisconsin. We recently grew the penicillium strain, the original Peoria penicillium strain, and I'm happy to report that it still makes penicillin. So after all of these years, we pulled it from a collection, regrew it, and it makes penicillin. In fact, our strain is still used to produce penicillin commercially worldwide, including in Illinois. So Baxter Pharmaceuticals in the Chicago district still use this USDA strain, the Peoria strain. Penicillin was originally isolated to fight gangrene wounds during World War II. And of course, during that period, it saved thousands of military lives. We should be all very proud of this fact and of the fact that it was developed here in the city in Peoria. And I just want to say thank you for your attention. Thank you.
T-shirt. We're probably going to have those available down at the Riverfront Museum and maybe elsewhere.
Councilmember Ruckriegel.
Thank you, Mayor. I move to approve the minutes of the City Council meeting held on February 25th, 2020, as printed.
Thank you. Seconded by Councilmember Graham. Any corrections or changes to the minutes? Seeing none, please cast your ballots. The motion passes unanimously. Madam Clerk.
We would be at the township portion of the meeting. 20-057 is a communication from the town officials with a request to approve the agendas for the annual town meeting.
Thank you. Councilmember Greer.
Yes, Mr. Chairman, what we have in front of us is the agenda for the April 14, 2020 annual town meeting of the town of the city of Peoria. And I know the township officials would be happy to provide any detailed information that might be required. If you have some thoughts or questions, you could submit those to the respective township official prior to the meeting. That would be helpful to ensure that we can answer any questions that exist. Of course, during the discussion, things can always emerge that can't be contemplated, but this is a Super Bowl of the annual town government, and that's why we publish this in advance, give notice to the public, let you know. So please come prepared. And with that, I move to approve the agendas for the annual town meeting, Mr. Chairman.
Motion to approve, seconded by Trustee Kelly. Any discussion on the motion? Seeing none, please cast your ballots. That motion passes unanimously. Thank you, Madam Clerk.
The second town item is 20-058, and it is a request to approve the February 2020 actual expenditures and to approve the March 2020 anticipated expenditures for the town of the city of Peoria.
Thank you. Trustee Greb.
Mr. Chairman, I move to approve as outlined.
Motion to approve, seconded by Trustee Sear. Is there any discussion on this item? Seeing none, please cast your ballots. And that motion passes unanimously. Thank you. Madam Clerk, at this time, we're going to kind of go off agenda a little bit. We had asked Dr. Matt Jackson and also Director Monica Hendrickson from the Health Department to come in this evening to brief the council and the Peoria constituents who are listening in on radio, TV, or live stream, just to give us a little update about COVID-19, where we are as a community, preparations that have been made, and so on. And then we'll have a little bit of time for Q&A. We appreciate them both coming in on kind of short notice, but we, with all of the information that's out there, we thought it would really be good for the council and also our listening and watching audience to have a strong feeling of the amount of work that has been done in the background. So so the audience knows that don't know, WCBU will be preempting the meeting at 7 o'clock. So we'll still be available live stream and cable 22, but we'll lose WCBU at 7. That's another reason why, with the concurrence of the council, we would ask that we would be able to allow this presentation at this time. And I'm seeing no objection from the council to do that. So Dr. Jackson and Director Hendrickson, thank you very much for being here this evening. Yeah, I had it up on mine. There it is. No, it's hot, but I don't know if you got it clicked up there.
Okay. Everyone's hearing about COVID-19 in the news. It's all over the media. There's a big panic, big craze out there. So I'm hoping to shed a little light on this and really what we're dealing with as far as the virus, as far as the disease, and what we're doing here locally. As you may know, I'm the medical director for pre-hospital and EMS for OSF Healthcare and also for Peoria Area EMS System, which covers here in Peoria. So I will go ahead and go through what the virus is, what the definitions, what we're dealing with, and sort of a current status update as far as nationwide, worldwide, and also here in Illinois, in addition to what we are doing from an EMS perspective and other public health concerns I can then relay over to my colleague here. So I'll go from there. Okay, so background on this. So originally we saw this outbreak in Hubei province in Wuhan, China, and we identified very early on that it was a coronavirus. And so people this is the big thing, everyone's talking about coronavirus. The biggest thing is, though, the coronavirus is a family of viruses that's very, very common. So, but these have a tendency to cause pretty severe respiratory diseases in some situations. The disease in this situation that it causes has been shortened to coronavirus disease 2019 or COVID-19. So that's what it's become known as. So that's what COVID-19 actually stands for. On January 30th, it was declared a public health emergency of international concern. On the 31st, the United States declared it a public health emergency in order to start preparations and really start mobilizing resources for the disease. So really, what is it? A coronavirus is a common family of viruses that typically cause acute respiratory illness. Everyone in this room has had a coronavirus at some point in their life. They may currently have coronavirus. I don't know. More than likely, it's not what we're dealing with as far as COVID-19. Really, what we know of coronavirus is that they're typically human-to-human transmission. We can also see it in animal reservoirs, and sometimes it'll jump species from animal to humans, and that's what we're thinking probably happened in China in this situation. The complete clinical picture of COVID-19 is not really fully understood. So we're going to really have to go back and know what we know about other coronaviruses and other syndromes that these things have caused. We know about MERS. We also know about SARS, those epidemics that happened a number of years ago. This is a virus that's in the same subfamily as those two viruses. It does not seem to be as severe as those other ones. The illness range for this has been mild to severe. It's not like everyone gets severe illness with this. In fact, the grand majority of people do not get severe illness with this. As of 3/10/2020, this is from the CDC today, there have been 116,335 cases worldwide, only 761 cases in the U.S., 11 cases in Illinois documented. There have been no identified cases yet in Peoria area or outside of Chicago or in downstate Illinois. And actively, currently, the healthcare community is preparing, and we are in continual communication with public health officials and with one another to make sure that we're adequately prepared here in our community. Overall, the risk to the general population still is considered very low. In comparison, to put this in perspective, so we all talk about the influenza, but this gets glossed over. Per the CDC, there have been 5 million plus flu cases in the United States, 140,000 hospitalizations, and over 8,200 deaths in the United States alone. So put that in grand perspective, this is really a drop in the bucket. So how is this thing spread? Currently, we think that it's spread predominantly from human to human, person to person within close contact, and they stay probably within 6 feet of distance. So really what we're looking at as far as the 6 feet of distance is that's how far you can sneeze or cough a particle on somebody else. And really think that it's predominantly a respiratory droplet spread illness. Typically speaking, symptoms will appear 2 to 14 days after exposure. Majority of cases are initially characterized by fever, up to 98% of cases. So that's really one of the hallmarks of this, and a cough. So those two things, so cough, fever, or fever and respiratory illness, those are your predominant symptoms. Sore throat has also been reported very early in the course, but doesn't seem to be a predominant symptom. And then also you can have some headaches. There have been some diarrheal cases reported with this and GI symptoms. The GI symptoms tend to be early, and then they fade. And also of note, asymptomatic and very mild cases have been reported. So risk factors as far as severe illness, because this is what we're all concerned about. We hear people dying. We see people in the news being in quarantine. We see people on ventilators, people at ICU, and all these different things. And so really, what are the risk factors for severe illness? So it's not entirely clear yet. We seem to be gaining in our knowledge as this grows, and we seem to extrapolate a little bit of other data from related coronavirus diseases that we know about. But it seems to really affect older patients. And what we mean by older patients, usually 59 and beyond, and those with chronic medical conditions. So those are the ones that are going to be more at risk. So lung diseases, cancer, heart failure, renal, liver diseases, diabetes, immunocompromising condition, HIV, chemotherapy, those types of things are going to be at-risk individuals. And what we're noticing, too, is that there's a potential for worsening of the disease in about the second week of illness. So the first week of illness tends to be fairly mild for most individuals. And even beyond that second week, if you're not an at-risk individual, it tends to still remain a fairly manageable disease. Most cases have also been in adults. If you look at the median age of onset, it's about 59 years of age. There's a slight predominance towards males, for whatever reason. And pediatric and younger patients tend to be either asymptomatic or have milder disease. So what is the treatment for this? Really, it's largely supportive. Isolation, quarantine, staying away from other people who could be at risk, and really preventing its spread is the main thing that we can do. There's really no specific treatment available from a healthcare perspective. We treat the symptoms, we treat the syndrome, we support the patient through that and help their own body recover from it. There are some potential vaccines that have been reported out there and some antivirals that have been in trials, but there's no data on this, and there's really no widespread availability for any of these or that they work yet. So what are we doing locally as far as EMS dispatch and response? This is pretty important. We are ahead of the ball in this, and we have enacted a pandemic response card. This is originally designed for the influenza season. We tailored it to fit COVID-19. We have 3 basic levels of response. We have level 1, which is as a surveillance, where there have been no identified cases in the area. And then there's level 2. That's when we know we're starting to see positive identified cases in the area. And then level 3, this is when our resources are actually low or getting low, either due to crews being under quarantine themselves or the call volume starts to spike, one of those 2 situations. Level 1 actually was rolled out today, and that's for Peoria and Peoria County. So what does this mean? So in 911 dispatch, somebody calls with concerns for COVID-19 or potential acute respiratory illness. The questions are going to be asked by the dispatchers, and they're going to be broad, and then the whole effort of this is to keep it broad and to catch as many cases as possible in order to increase situational awareness for our providers. Essentially, the question is going to be limited down to fever and respiratory symptoms. So if they fever and respiratory illnesses, then it's going to trigger the card. And that's all the crews are going to know. They're not going to be asking questions about travel or exposure. That's up to the provider to do when they get on scene. So initially, when a provider gets on scene, they're going to be walking in the door, maintaining at least that 6 feet of distance, probably having some basic protective equipment on, and they're going to be eyeballing the patient to see, are they alert, are they oriented, or do they have any priority symptoms in their respiratory distress? Do we need to enact care right this second? If not, if the patient is ambulatory or able to discuss with them, then they're going to go down to the questions as far as exposure risk. So have he or she traveled in the last 14 days? If so, where have they been? If yes, confirm travel from a known infected area. And then also contact with a person who has either traveled from a known infected area or who has been confirmed positive or suspected to be positive. Those will trigger basically a COVID-19 person under investigation alert from the pre-hospital provider. So if these questions are positive, the provider then dons all the appropriate protective equipment to keep themselves safe. All other providers are basically going to have to stay outside and stay away from the patient. So only essential personnel that will need to take care of the patient are going to be the ones enacting care with the patient and providing getting all the protective equipment on board. The patient will then have a surgical mask prior to moving or initiate any significant care to the patient. Family members will basically be instructed to do a home quarantine. Even if they are asymptomatic at that point, if they are suspected to be an exposure, they'll be told to stay at home, and they will not be allowed to ride in the ambulance. So as far as that is concerned, once we kind of reach a level 2 to level 3 level of our dispatch priority here in this town, what we're going to do is we're going to start having some people with fairly mild or manageable disease and encouraging them to stay at home and giving them that pathway. So during this, we're going to be going through a thorough assessment with the patient, including a complete set of vital signs. There's going to be certain criteria that they're going to have in order to be considered for this pathway. In other words, lack of priority symptoms, normal vital signs, lack of comorbid conditions, all the things that I mentioned previously that make them in an at-risk category. Under the age of 50, again, we could ratchet this up, but I'm being safe. We're keeping it a little bit lower because the majority of people who are healthy and under the age of 50 tend to not have any issues with this. And then physician medical control will be contacted in all of these situations, and they will be giving the approval or the denial of this. And if it is denied, then the patient will be summarily transferred to the hospital. Patients will then be given detailed instructions for home care, follow-up, and will be instructed to call their local health departments and the primary care physician and provider for further instructions. The biggest things for instructions to the public is prevention. This is one of the biggest important areas that the public can impact, and this is the biggest piece of education for a lot of people. First off, when you're out in public, you're touching things, common surface areas, whether you're out in the store, you're touching doorknobs or countertops, these are where the virus will potentially live. You should avoid touching the face, especially after being in public. Okay, that's the route of infection for this. Good hand hygiene, frequent hand washing, use of hand sanitizers, and then obviously avoid contact with others who appear ill or who you know are ill. As far as taking care of yourself, that's another big important thing that people can do if they do contract the disease or if they have any kind of flu-like illness or any kind of respiratory syndrome. So stay at home if you're ill. Don't go to work. Don't go to public. Don't go shopping. Keep your illness at home. So cover your cough and your sneezes. Call ahead prior to visiting your doctor. Your doctor does not want you bringing COVID-19 into their waiting room. So if you have concerns with this, if you have known exposure, you're concerned to have one of these things, it's a good idea to call ahead and talk to your symptoms with your primary care physician's office or your clinic's office prior to visiting. And then obviously, if you are ill, avoid contact with others. It's important to know, too, that as far as wearing surgical masks in public, it does not prevent you from getting the disease. If you do have illness, it does prevent you from spreading the droplets, at least to some degree. So there is that thing. I encourage people to not go out and buy a bunch of masks. Those are for the healthcare providers, and that keeps our healthcare infrastructure and our public safety sector safe. So in summary, there's really no need to panic. There's been a lot of hyperbole, a lot of exaggeration in the media. If you were to take all the people in the world, from the people we know right now, the people we are testing are for the most part either family members of people who have been ill or people who have been symptomatic and who are truly ill. So if you look at that, the overall mortality rate falls between 2 to 3% worldwide, and that's in other areas where healthcare resources are scarce. So if you take everything into consideration, if you look at all the people that are probably mild or asymptomatic disease who do not seek treatment, the mortality rate is far lower than that. And so this is not spreading widespread in an uncontrolled fashion in this country. It's not really expected to, although we are. It's in our best interest to be prepared. Just because it's a new virus, it is a novel virus, and we're still learning about it. But there are no cases yet in downstate Illinois. Overall, most of the cases that we are seeing are manageable, and our local healthcare community and public service sectors are actively preparing. Our protocols are being implemented, and we're in communication with one another. So the situation is really under active surveillance, and it is considered fluid, and updates and protocol development will continue to occur as it is warranted and as we know more about the disease. Questions?
Thank you for that. And as I said, Director Hendrickson is here from the Health Department too. If there are any, if the council has any questions while we have him here, I have Councilmember Ali up first.
Oh, thank you, Mayor, and thank you, Dr. Jackson. Appreciate the presentation. How long might a person carry COVID-19?
Again, from time of exposure to time of disease onset is somewhere within that 14 days. So on average, we're thinking it's probably more the 3 to 10 day mark before you get symptomology. So if you're kind of making it to that 2-day or 2-week period and you've not developed symptoms, including fever, cough, more than likely you do not have the disease.
Okay, and then what about the availability of test kits, and what's the process for testing in our area?
So actually, the state of Illinois was the first state to have testing for COVID-19. It's currently done through the 3 state labs, Springfield, Chicago, and Carbondale. The process still continues that a healthcare provider makes an assessment of a patient, and based on that healthcare provider's assessment of their patient, they reach out to the health department or the local health department of that patient to start the process of having this person under investigation. Once that happens, we release a authorization number that allows them to get the testing completed at one of the state labs. But the big takeaway that we want to really stress is that is based on your healthcare provider's assessment. And so we don't want individuals to necessarily think that they can get tested just at any provider, but it's those people that are symptomatic, that have other respiratory illnesses, that have a travel history risk, or no kind of understanding of what's going on for the respiratory illnesses. And it's a decision by your healthcare provider and the health departments. And so we really want to make sure individuals that are thinking about testing communicate via phone with their healthcare provider first.
Do we know, Monica, how many test kits we have in Peoria County?
It's not necessarily in Peoria. It's just through the 3 state labs. But I will say that there is not as many tests nationally as we would want it to do. And that's why that process is laid out, because we are still prioritizing testing based on high-risk individuals, whether it's travel history or the fact that they have no explanation of their respiratory health issues. And so, again, it's still limited the number of tests, and that's why we prioritize it, but it's a decision between the healthcare providers and the local health departments.
So if someone is suspected of having the disease, how long does it take to get the test kit?
So
Longer.
healthcare provider would start actually collecting the specimen, and then it would be couriered straight to one of the state labs. And it's usually for initial testing, we get the results within about 24 hours, and then it goes to the Centers for Disease Control and Prevention, or the CDC, for confirmatory testing. And just so you understand how fluid it is, I believe Dr. Jackson made these slides just this afternoon, and already that number has changed. And actually, we had our first 2 cases outside of the Chicago-Cook County area, and it's McHenry and it's Kane County. So we do know that it is growing in capacity, but that's why the information is really key, that majority of people can self-care at home, and that you really need to communicate with your provider before necessarily going, as well as really understanding that the role of EMS and our emergency departments are for those really high-level needs.
Okay. Thank you very much.
All right, Councilmember Sear next.
She asked my same question already.
Okay, thank you. I'm seeing no other lights this evening, so I just want to thank you both for coming in this evening. Obviously, the community is very concerned about this, watching it closely. We put some basic information up 2 weeks ago on the city website with some Q&A basics on this, which are still up. We'll have Doctor's PowerPoint up probably after this meeting, if not first thing in the morning. So if anybody in our listening audience wants to do that. Information obviously is the key on this. Appreciate your diligence in helping calm the waters. As we talk about so many times, we're so lucky to have the outstanding medical community that we have here, especially with you two in leadership positions, and we thank you for that. So again, thanks for coming in on short notice. We really feel like this was a good opportunity to provide good information to folks that watch and listen to the council meetings. And, we wish you both the best of luck and have a lot of confidence in your ability to help our community get through this. Thank you very much. Madam Clerk, we would be back to the regular agenda now.
We are at the consent agenda. 20-028 is a request to approve the amendment to the guidelines of the East Village TIF housing program to allow the participation of non-owner occupied properties. 20-059 is a request to approve the purchase of 3 thermal imaging cameras from Dingus Fire Company in the amount of $23,985. 20-060 is a request to approve a 2-year contract for the annual purchase of ammunition for police training use from the low bid of Acme Sports in the amount of $25,125 and for a 2-year total of $50,250. 20-054 is a request to adopt the ordinance amending Appendix A, the Unified Development Code, relating to setbacks along thoroughfares, and 20-061 is a request to approve the site application for a Class H temporary outdoor liquor license for an event to be held by the Yellow Bear Foundation in the 600 block of Southwest Water Street in front of Kelleher's on March 14th, 2020. And that completes your consent agenda.
Thank you, Madam Clerk. Any items to remove from consent this evening? Councilmember Kelly.
Yes, Mr. Chairman, 20-059, please.
059. Okay. Any other items to remove from consent? Seeing none, we have a motion to approve the remaining items. Councilman Sear, seconded by Councilmember Ruckriegel. Please cast your ballots. Motion passes unanimously. Thank you. Madam Clerk.
20-059 is the request to approve the purchase of 3 thermal imaging cameras.
Councilmember Kelly.
Thank you, Mr. Chairman. I'm not sure I have an opinion on this, but I wonder if the chief or someone could give us a little background on $8,000 cameras. I'm not disputing it, but it just seems, and there wasn't anything in the online packet. So, please.
Certainly. So we've had these type of cameras on each one of our machines for about 15 or 20 years, and this is basically just our annual upgrade to improve the quality of the cameras. Actually, they're really run between $10,000 and $12,000. The reason we're getting at such a discount is because Dingus provides a exchange program. So we exchange a few of our older cameras for the newer ones, and then they end up trying to refurbish those and sell them at a greatly reduced price to smaller departments throughout the country.
I guess we're. Thank you, Chief.
I'd be more than happy to answer if that didn't answer your question.
Perhaps I should just get myself informed by just meeting with you about this. I don't really have an objection. It just seemed that was a very high price, but I'm sure it's fine. So,
okay.
Thank you, Chief. And I would move to approve.
Motion to approve, seconded by Councilman Ruckriegel. Further discussion, Councilman Graham.
Just in brief, I can remember the day when we did not have these available on our fire apparatus, and we were at one point thinking about doing cookie sales and bake sales to cover all the apparatuses that we would need to cover with these thermal imaging cameras. And the community came together and said, no, this is so basic. This will save lives right away. And Chief, when the truck rolls up and a house is ablaze, these thermal imaging cameras do what?
So these cameras actually serve a multitude of purposes. In a situation that you're referring to, Councilman, where these really come into play is it really helps our personnel when they're searching for victims in a house fire. Obviously, it's zero visibility, and they'll still do the hand search, but if a victim is in the house, they're clearly seen through this camera. Perhaps even a greater asset of these cameras is if we smell something in a house or we're not able to really find anything. In the past, when we knew something was going on but we couldn't actually see it, we'd have to open up a wall to try to locate the electrical problem or the heat. With these cameras, we're able to scan the entire room, see if there's a change in temperature, and actually isolate where the problem is without causing any damage.
Technology revolutionized fire safety.
It absolutely did, yeah, without question it did. And I was remiss, Councilman Kelly, this did go out for bid in August of 2019. We received two bids, one from Dingus and one from another vendor that didn't meet the specifications, so this was the only bid actually that we received in August of 2019.
And of course, Councilman Kelly is just talking about the price point to be sure that the taxpayers are getting the best deal here. Thank you very much, Chief.
Yes, sir.
Thank you. Any further questions for the Chief? I'm seeing none. We have a motion to approve. Please cast your ballots. That motion passes unanimously. Thank you. Madam Clerk.
We're at first readings. 20-062 is a request to concur with a recommendation from the Advisory Commission on Human Resources and staff to receive and file a first reading review of an ordinance amending Chapter 2 of the Code of the City of Peoria relating to the Advisory Commission on Human Resources.
Director Black.
Thank you, Mayor. This is a very simple amendment to the text to change the name of the Advisory Commission on Human Resources to the CDBG Public Services Advisory Commission to better reflect the task that is assigned to that particular group.
Any questions for the Director? If not, I would accept a motion to receive and file. Councilmember Ali, seconded by Councilman Sear. Please cast your ballots. That motion passes unanimously. Madam Clerk.
20-063 is a request to receive and file a first reading review of an ordinance creating Article 6 Lift Assistance of Chapter 11 Fire Prevention and Protection of the Code of the City of Peoria, allowing for a lift assist cost recovery fee to be charged to assisted living facilities, life care facilities, and nursing care facilities.
Thank you. Chief, you want to give us a little more information on this?
Yes, thank you, Mr. Mayor and Council. Before I start, just wanted to give thanks to Corporation Counsel Chrissy Peterson, for she was a tremendous help in crafting this ordinance. What this basically does is sets a policy to where any assisted living facility calls the Peoria Fire Department for a lift assist call where the patient is not injured, they simply need lifting up from the floor. They would be charged $400 per incident. I have to stress that this does not affect the homeowner. This does not affect those living in independent facilities. This is strictly assisted living facilities that this would affect.
Chief, can you help me understand how we came up with the fee at $400?
What we did was we looked at some other ordinances throughout the country, and we kind of looked at what our goal was with regards to this ordinance. And in speaking with several people, the goal was to make this deterrent, not necessarily make money. Certainly, the $400 does not cover the cost of the fire department responding to these calls. It was more of a deterrent, and I think we've already seen just with the discussions that have taken place in the last couple of weeks that it has worked. We had a very good meeting with a representative from one of these facilities this morning, and I think both sides have a little bit better understanding what's going on. But there really was no rhyme or reason other than we thought that this would be a distinct deterrent with this fee, and we knew we could adjust it if it wasn't. But what we found throughout the country, that other municipalities who have incorporated this type of an ordinance, it has been successful.
I appreciate that answer, and I'm pretty confident. It's first reading anyway, but I would like to have, and I don't need it even for the actual approval. I would like us to know what that number really is, because I know it's more than $400. So I appreciate the deterrent side of this. I do think that it's appropriate that private business accept the responsibility for this cost. It's not going to affect any of our tax-paying citizens, so I appreciate that. But I think it's important for us to know that the real number, I imagine, is going to be quite a bit higher than that. So don't stay up tonight working on it, but I would like to see that sometime in the near future if we could. I have Councilman Graham next.
Yes, Mayor, I entirely agree with you 100%, and I do know that some things are almost unknowable, but I would be more comfortable to approve a dollar figure that actually is reflective of what our cost is when we have the next reading, since this is a first reading. I understand the deterrent effect, but I think that what we approve should be what we should have to charge to recapture the cost to the taxpayers, because after all, they should staff their facilities appropriately. Emergencies are different. And so, I don't have any pangs of guilt by, if it's $700 or whatever it's determined, maybe you can crunch the numbers and make it as knowable as possible, to approving that figure. And I guess I'm echoing exactly what the mayor was, where I think you were going, Mayor Artis. So I would like to see that figure the final time around, since this is a first reading.
Thank you. I had Councilmember Kelly next.
Thank you, Mr. Chairman. Chief, if you know, we don't know how much this is going to generate, et cetera, and I think it's a very good idea. When these fees are paid, where does the money go?
I'm assuming, and I'm a little bit outside of my depth here, but I'm guessing the general fund.
Thank you.
Councilmember Ali.
Thank you, Mayor. Chief, based on your knowledge and awareness, is this fee likely to be passed from the assisted care facility on to the resident?
I really don't know if history proves accurate, I would guess, but I don't, to be honest with you, Councilwoman, I don't know how that operates. I don't know if these residents who are in the assisted living facilities, pay a set fee and that cannot be adjusted. And I mean, again, medical staff is on hand for these facilities. I don't know if the contract allows for them to increase what they're already paying. I really don't know that answer.
Okay, thank you.
And Councilman Ruckriegel next.
Great. Thank you. Thank you, Chief. Hearing through your comments there, and I just want a clarification, I think, for the public, because I heard you, I believe, loud and clear, and I'd like for you just to verify this. This is not a revenue generation point that either the fire department or the city is looking at. This is really a, hopefully, an inducement for assisted living facilities to properly staff during those times that they may require this action, so that they are the front line of being able to do this action and don't tie up our limited resources in other aspects where they may be needed. Is that correct?
That's exactly correct, Councilman. And this certainly won't be a moneymaker, even if we come, and we will come back with the approximate cost of when our machine rolls to that scene. But even if we charge that amount, it would just be a break-even point. And I have to reiterate the fact that we've been adjusting how we respond to certain incidents over the course of the last 2 years. As you all know, we adjusted how we respond to automatic alarms. We just recently adjusted how we respond to gas leaks inside of a residence. This is just a furtherance of that. We're trying to keep our limited resources available for true emergencies.
Thank you.
And Councilmember Montalongo next.
Thank you, Mr. Chairman. Chief, so it's both probably the staffing levels that the care facilities, I guess, don't have, and probably equipment to help pick people up when those scenarios happen. So I'm just guessing no?
In most instances, an assisted living facility, a nursing care facility, a life services facility should have the lift equipment on site and the healthcare professionals to provide the lift assistance in these cases. So they should have that. That's part of the regulations that they're governed under the Illinois Department of Public Health.
I guess the question is then why do they call us to call the fire department to come or emergency services to come?
Well, I think it's in some ways it shifts any concern about a lift off of that employer who may have a worry about workers' comp with a lift and puts it squarely on the public body. And I think that that's the biggest concern and why we've tried to structure this as a deterrence, is that it's really not the public's role to provide that type of lift assistance where there are healthcare professionals in place that can do that kind of work.
Yeah, so I was just under the, I guess, misconception that they didn't probably have enough staff or the right equipment. So they do, they just choose to, for the reasons that you stated, Mr. City Manager, on why we probably get that phone call. So thank you very much.
Okay, thank you. I'm seeing no further questions. We can take a motion to receive and file the first reading. Councilman Sears, second, Councilman Ruckriegel. Please cast your ballots. The motion passes unanimously. Madam Clerk.
We're at regular business. 20-064 is a request to adopt a voluntary home security camera registration program.
Councilmember Montalongo.
Thank you, Mr. Chairman. As you all may recall, at our last council meeting, we amended the budget to bring over the remaining funds of the ring security camera program that we had in place of around $29,400 to the 2020 budget. At that time, I asked to bring forward a policy to this meeting. So as much as we liked the ring program last year, they discontinued it, so we had to come up with a new program to provide security cameras on the doorsteps of our residents. So our policy in general reads that any City of Peoria resident, homeowner, or tenant will receive a $50 incentive from the City of Peoria for purchasing and installing a home security system. There are a few requirements that go along with that. of course, be a resident of the city of Peoria, and the camera be installed in the city of Peoria, provide a receipt, the camera be registered with the City of Peoria Police Department, and 1 camera per household. So we learned at our first ring event, the feedback that we got, that our residents were feeling very safe and very secure at their homes with this type of program. Not just in their homes, but just as well in their neighborhoods. We also know that our police cannot be everywhere at one time, so all these cameras help deter crime and support our police department when needed. So with that, Mr. Chairman, I move for approval.
We have a motion to approve, seconded by Councilmember Kelly. Discussion, Councilmember Jensen.
Oh, it's on my...
Okay. Any discussion on this item? Okay, seeing none, please cast your ballots. The motion passes unanimously. Madam Clerk.
19-278 is a request to adopt an ordinance amending Chapter 3 of the Code of the City of Peoria, authorizing the sale of alcohol in movie theaters.
Councilman Sear.
Move to approve, Mr. Chairman.
Motion to approve, seconded. I had about 3 of them, but I saw Councilman Ruckriegel first. Discussion on this item? Seeing none, please cast your ballots. That motion passes with 8 ayes, 2 noes. Council members Ali and Graham. Madam Clerk.
We would be at unfinished business.
Do we have any unfinished business to come before the council this evening? Unfinished? Seeing none. Madam Clerk.
We would be at new business.
New business come before the council this evening. New business. Councilman Ruckriegel.
Thank you. Just a reminder that this is our 25th year for the City of Peoria and the Peoria Civic Center for hosting IHSA March Madness, the original March Madness. And over the next 2 weekends, we are going to be having quite a few visitors come to our city to enjoy what we're so proud of. And just a reminder to come on down, see some great basketball. We got Class 1A and 2A this weekend coming up, and 3 and 4A next weekend. And you're not going to see more spirit at any time from great athletes from all over the state than right here. And so 25th anniversary, come on down, help us celebrate with all of our visitors and make this a wonderful, wonderful 2 weekends.
And Councilman Ruckriegel, I appreciate you bringing that up. I appreciate both your service on the Civic Center liaison, who's doing a lot of work on this, but also you're on the helping us coordinate the efforts with the IHSA Steering Committee. And just to expand just a little bit on that for the public, it is our 25th year. It's also the last year of the contract. And we are very aggressively working on not only achieving an extension for the boys, but we're also hoping that in its efforts to really achieve true parity between the ladies and the men's programs, we're trying to have all of them in Peoria going forward. So there's a lot of effort out there. We appreciate all the service industries, the hotels, the restaurants, hundreds literally of volunteers in the community that come down to help this effort really go off as successfully as it does. So thanks to you for your efforts, but thank you to literally hundreds of Peorians who volunteer over this next couple weekends to really put on a good show, put on a good face for the city of Peoria, and really make lifetime memories for the kids who are here for the state tournament. Thank you. I had Councilman Riggenbach next.
Thank you, Mr. Mayor. Just a couple quick things. The East Village Gross Sale Housing Program, which we amended earlier tonight, will open for new applications on April 6th. So those homeowners and interested parties mark April 6th that the applications will be available for this year's funding. And second of all, I thought it might be appropriate to have Assistant City Manager Rattler explain to the public a little bit about what's happening at Riverfront Park with the turntable. It's something that we've been talking about off and on here around this horseshoe for some time, and After having that public meeting in October, I believe it was, there was some consensus, and she showed me the place where it's going to end up in Monticello, and it's a pretty cool setup they have there. Their railroad museum is something that I think this will be a great addition to. So, you would please.
Sure. Just this actually started before I began with the city, and so it really was rooted in a lot of work that was done by my predecessor, Chris Setti, working on riverfront initiatives. And that was when the conversation with the Monticello Railway Museum began, and it revitalized after I started with the city, and we began talking about this structure. And just to share, a turntable, before diesel engines, before engines could go in reverse in the railway system, they actually had to physically turn them around. And a turntable did just what a record does on a turntable. It just turns an engine around so that it can go in the other direction on a track. So a vital piece of equipment, and also vital for maintenance. But unfortunately, the turntable that we have in Riverfront Park is standing alone without context. And in fact, when we recently, in the 2016 time frame, did an archaeological investigation, we found it really not to have high levels of historic significance like some of the turntables that are actually in yards around the state of Illinois and in neighboring states. And so when we came to the community and held this public meeting on October 17th, we got nearly unanimous support. Not always excited support, because there's this sort of wistful wish that there was something that we could have done with this structure, but really delighted that we found such a good home in the Monticello Railway Museum. And for those of you who don't know, this is a real working museum with equipment like cars and engines dating back to 1903. And so this is the real deal. They have an amazing and incredibly popular Polar Express every winter. I encourage you to go if you're bored this coming winter. And it is a real-time live track that they have hundreds of pieces of rolling stock that they put on. And this turntable would be is an amazing addition. They've been planning for it for some time, and at that meeting, they showed the plans. They showed where the turntable would be installed, talked about a dedication-type plaque plan that they're putting in place to thank the people of the city of Peoria for the donation, and why it's a vital piece of railroad history, but now it's going to be a vital piece of railroad history in use and in context, so you really can understand what it is and what meaning it has within railroad history and Illinois history. So we're very excited. They started this winter doing some assessments as Polar Express ended, and we had amazing weather, and all of a sudden they called me up and said, we're really moving, we're getting the decking out. And so we've been moving much more quickly than we had expected. We had expected something that would be in competition with regular demolition crews through the summer in terms of scheduling and finding things, and all of a sudden there was just people available and plenty of good weather, and they just got a lot done. So if you go down, you will see there's a lot done. It's not all done, but they are progressing quite well, and it is with the intention of refurbishing this to full use in the Railway Museum.
Did you have questions for the Assistant City Manager?
One thing, if you could just kind of touch on, and I know it's kind of an unusual situation because you've had a couple of people who have ties to the turntable, family members, or that have other sort of storied, it falls within their families or friends, and they're kind of excited that this thing is going to be going back actually into use versus just sort of being a static piece. Is that correct?
That's absolutely true, and I've had some really wonderful conversations, one-off conversations with folks with very deep memories of the Rockford rocket. Is that what they called it? I wasn't around for it, so what is it? Okay. Okay. I can't hear you, but I'm just going to say okay and pretend that other people can hear you. But remembering when there was a roundhouse there, and remembering when people were truly operating out of Peoria as a railway hub, and this structure really evoking those memories so deeply, and so excited to see it have a future ahead of it instead of just ongoing deterioration. So.
Councilman Jensen, would you have a question for the Assistant City Manager, or were you for something else? Okay. Okay, thank you very much. Still in new business, Councilmember Jensen.
Thank you, Mr. Mayor. I just wanted to thank the city manager for providing us with that update and report just before the meeting on the coronavirus. And although I know I missed the presentation from Dr. Jackson and the director of the health department, just wondered if you could touch upon a couple of the items that the city's doing in particular that you addressed in your report.
Certainly. I think that first and foremost, as you heard from Dr. Jackson, the public entities, the health department, the fire department, the emergency communications center, the police department, all of our first responders, which are very involved in addressing through the EMS system the protocols and the procedures that we've put in place on this front. Internally, we have had in place since 2006 a pandemic flu plan, and that plan is something that we're revisiting right now to revise, make changes to it to reflect some of the guidance that we're getting back from the CDC that may be different than what was in that plan that was adopted in 2006. But we're also working, I think probably the big thing within that plan, and that it's the same today, it's looking at, as every business should be doing right now, if you look at the guidance that's coming from the CDC, what are your business continuity plans that you would have in place if your employees and your workforce are affected by that? Secondly, what can you do to mitigate the spread of COVID-19? And that's something that we're doing, looking at replacing our soap dispensers in our facilities and providing more hand sanitizers. But then also, how can we assist our employees as they may be managing any of the personal issues that may come up if someone is affected by this or in the family. So those are the aspects of the plan that we're currently revising with that. The biggest focus for us, obviously, is that we know that we have first responders that are going to be actively engaged in this process of assisting people that may have an illness, this COVID-19 virus. So that's something that we need to be prepared for, and it's something that we're starting to work through. The fire department has made sure that all of their employees have been trained on the protocols of that and have worked through that. And we're continuing to do that with the police department as well. So I think that, we're taking those steps to ensure that we can, and we'll be working that plan as it progresses. As Dr. Jackson said, it's a very fluid situation that changes very quickly. So we just need to be prepared for that.
Thank you.
Thank you. Is there any additional new business this evening? New business? Madam Clerk?
We're at citizens' opportunity to address the City Council.
I have no cards this evening, but if there's anyone who would like to address the City Council at this time, you're welcome to. Okay, seeing none, Madam Clerk?
We have an executive session.
Council Peterson?
We have executive session pursuant to 5 ILCS 122C11 for probable litigation and 2C21 for closed session minutes.
Okay. We have a motion to go into executive session. Councilman Ruck-Riegel, seconded Councilman Euler. Please cast your ballots. The motion passes unanimously, and we have a motion to adjourn by Councilman Sear, seconded by Councilman Kelly. Please cast your ballots. That motion passes unanimously. We'd like to thank Kathy Reinerson and her listening audience at WCBU, as well as Cable Channel 22, and this evening's meeting is adjourned.